Good morning, everyone. It is day 3 of the Canadian Rheumatology Association and Allied Health Professions Association annual meeting where all things science about arthritis and musculoskeletal disease are being shared amongst colleagues, patient organizations like ours. We're so happy to start our day with a really dear friend, longtime colleague and collaborator, Dr. Linda Lee. Dr. Lee is a Canada Research Chair in Patient-Oriented Knowledge Translation. Her bricks and mortar are right here in British Columbia, so we're very happy to have very good access to you and your knowledge base. Tell us a few of those other fancy titles that you have, Dr. Lee.
Good morning, everyone, and thank you, Cheryl, for the opportunity to speak with you. It's always a pleasure. And
you're speaking with all of those people out there.
So I am a professor at the Department of Physical Therapy at the University of British Columbia and a senior scientist at Arthritis Research Canada.
Yeah, so she's really smart, and she's got it all going on, and her specialty, you're actually trained as a PT. So you're a trained PT, yeah. You teach PTs what to do, PT meaning physiotherapists. But your research niche, apart from the global heading of knowledge translation, is really has focused in on digital, e-health, online learning, online decision-making aids, wearables such as Fitbit, and doing research with those things. So I'm going to ask you, before we talk about what you talked about here at the meeting, give us the Coles notes on where you've come from with maybe those few research projects, and where you think we're headed with digital technology, wearables, things like that.
So Cheryl, as you mentioned, I am a physiotherapist by background, and so exercise, physical activity is something that's really near and dear to my heart.
Yeah.
We know that being active is a good thing, not just for people who are healthy and fit, but especially for people with arthritis. Right. It helps to control the pain, better function, move better, you feel less stiff. So there's so many good benefits for being active. But we also know that a lot of people, for one reason or another, that they are not as active as they should be. So one thing that we are trying to do is to leverage some of the technologies that people are already using, like wearable devices.
Yeah, I mean, everybody seems to be wearing a Fitbit.
Exactly. Yeah. So what if people can know better about what they do and be able to correspond with how they feel? Right. I think that it's very powerful for individuals to learn about themselves, and then they can adjust their activity accordingly. Yeah. So we started a line of research project, and we call it a knowledge translation project because, you know, the knowledge about being active is good, has been there for a long time, but people are not doing it. Yeah. Right. So, so we're trying to, you know, get to the point that for people to be more active, and we use Fitbit combined with counseling with the physical therapist, right, and to help people learn how to set goals, how to practice to be active, and get to the point that they can achieve the goal. I think that is the most powerful feedback for people. Yeah,
I think people kind of look at those devices or look at their camera, which has core motion sensors in them now. And, you know, for some people who may require a bit more exercise, but have it in their head that maybe, let's say 8,000 steps is enough. Well, maybe for them they need a little bit more, maybe for them they need a little bit less. So it sounds to me like your work is really zeroing in on trying to help people understand what is the right amount of exercise for them, using different sort of data points to inform that decision making. Is that right?
You're absolutely correct. Okay. Part of it is to help people to achieve that minimal amount of physical activity that is good for their health. Yeah. So we know that, you know, the 30 minutes, you know, most days of the week, moderate, you know, level. So, you know, walking a little bit quick, you know, doing your pool exercises, you know, for a lot of people with arthritis, that's really a nice thing to do. Or, you know, for people who like Tai Chi, for example, that is actually moderate level activity.
It's hard. So, I see people doing it in the park all the time. I'm like, whoa. Yeah, it's not just slow movements. It's that really controlled movement that is very strenuous.
That's
actually,
right.
Yeah.
So that's the first part we want to get people to. The second part is that people need to have the knowledge and feel comfortable that whatever they're doing is not hurting their joints.
Right.
So it's the using devices that can track and give feedback with the physical activity, as well as getting the feedback from a health professional from far away.
Yeah.
You don't have to go to the clinic to see someone. It gives you the sense of comfort and confidence that you can do something but without hurting your joint.
Yeah.
So it's that lower level and upper level that we're trying to get people to learn that's right for them.
Yeah, I think the word I really just latched on to in my head, based on all the feedback that we get from our members and people from the public who have arthritis, is the word confidence, and the lack of it when it comes to decision making around what kind of exercise they should do, when they should do it, how much they should do. In fact, I have rheumatoid arthritis, as you know, and when I was first diagnosed a million years ago now, everyone said rest, don't do it, don't really push it.
Yeah.
And because I was a high performance athlete before that, that just didn't make sense to me. I really felt like, I had been at a very fit level. So I kept doing, actually, all the things that my physiotherapist was telling me not to do. I did them safely. I practiced safely as I could. Practiced joint protection, didn't go crazy. But I really do think it was just that intuitive thing inside me that said, keep exercising. And now we know the research says that was right.
Yes.
And it's taken us that long to know that actually high intensity exercise for periods of time, done safely, can be good for even people with autoimmune diseases.
Yes.
So that's the big revelation, I think, over time for people like me with respect to the research that you've been doing. So thank you very much for leading the charge, Linda. It's been fantastic. I want to ask you about the answer tools, because I know one's nearing publication or in publication, or
it's coming
just
out next month.
It's coming out next month. I thought I saw one of those emails go across. So you've done two, and they're called Answer.
Yes.
And the first one was on?
For people who are considering methotrexate for rheumatoid arthritis.
Right. And that's online and available to
Yes.
people. And it's online at www.arthritisresearch.ca. If you search, you can find it just by putting an answer, or you click on Linda Lee and you'll see all of her projects. So if you're in a point where you're trying to decide whether to go on methotrexate with your rheumatologist, please take note of that particular tool. And then the biologics one is still, will it be available online?
It will be available around summer of
Okay.
2018.
Does it include targeted small molecules
Yes.
in it? It does. So it's all of the advanced therapies, that tool. So you'll have to go back again in the summer. Next year, you said? Or
No,
this year?
this
year. To look at that tool. I have one last question, and then we're going to go to our audience.
Okay.
So you've been tasked with several, you gave the keynote talk here at this year's meeting, so congratulations on that great recognition. When you think about your work and the theme of this conference, which is precision medicine, how do you think the area that you work in, e-health, digital health, wearables, physical activity, when we think precision medicine, I think a lot of people in the public think pills or shots or medicine. But precision medicine relates quite well, I think, to the field that you are a leader in. So tell us your views about that.
So I'd like to bring up a very important initiative globally. Exercise is medicine.
Yeah.
So I think we're right in the ballpark.
Okay.
About looking at not just the medical management, but exercise. How do we prescribe more precisely, monitor more precisely, and help to change and sustain the behavior that is right for the person? So it's personalized and it's more precise. And with the use of technology that people can actually track and see how they are doing, that gives another level of knowledge and confidence that people can learn about themselves and be able to make changes that is right for them. So I think we're right there with precision medicine.
Absolutely. In fact, I learned at the great debate last night here at the meeting, we've actually been moving towards precision medicine all along in rheumatology care, whether it's by a rheumatologist, by a physiotherapist, by an occupational therapist. It's the tools you have and the research that's informed those tools that help you zero in on a personalized prescription, in other words. And I think the public generally thinks of precision medicine as a fancy, expensive machine that hovers over you and does something. And it's not. No. It's actually the art of all types of medicine or therapies combined together that focus on your particular needs.
Absolutely.
There you go.
Yeah.
We're going to go to the audience quickly, and then we're going to let Linda go on her way because she's got a busy day ahead of her.
There's a question from a viewer. She's saying that I have a wearable device, but how do I ensure I maximize its benefits and keep myself interested?
That is $1 million question. Well, one of the things that we know about wearable is that it's good, but it's good to a certain degree. Yeah. And if people know how to interpret the information that is provided by the wearables, it is informative, it's motivating, but the key is that if you or others who may not be able to understand, some of the information that is provided from the wearable, make sure that you are able to work with an exercise professional. It can be a doctor, a physiotherapist, or even, a kinesiologist or a fitness trainer who understand how to look at physical activity levels and the profile and be able to give you some personalized recommendation about how to maximize your activity. So, but getting the information, get the data is a good thing. That it allows you to actually analyze and understand how you're doing and how you can do better. Right?
Yeah, and I think some of those tools also have sleep trackers, and I mean, sleep obviously is a big deal.
Yes.
And how you sleep is a big deal.
Yeah.
So I think we also have to factor in the times we're not moving and what that's it's hard to call sleep or rest activity, but it is, because it delivers something to your body and certainly does something hopefully beneficial for your arthritis over time.
Yeah.
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 Other questions?
We have a specific question. There's a viewer who likes to play golf, and he finds that when he plays too much, his lower back and knees ache. So is there a way that he can play it in a less painful way, and should he restrict his movement in any way?
Yeah, so I think that's a really specific question that, as much as I would like to answer, not able to see the individual, it's hard to give specific answer. But I do think that if, certain activities that, sort of cause discomfort, you probably want someone who knows those kind of activity and sports to be able to see what you're doing. It could be that the length of time, it could be that how you do it, and according to what, is the source, there are different ways that you can modify how long, when, how frequent you're going to do it. So I would recommend working with someone, who understand, physical activity and playing golf, to analyze the activity.
Yeah, I think the most important thing for this particular person really is actually reaching out to someone to get the answer that is best, specific and precision, if you will, for that particular viewer. I always say don't give up. Like, there's got to be a way to modify. Address the problem is obviously probably the first step. See the right person to deal with that problem, and then work on the solutions. And I have to say, as a person who used to play sport, I wanted to play tennis. I wanted to keep playing tennis, but my joints, it was really hard. So I built up the grip on my racket. I made sure I played at a particular time of day. actually, that where my body felt the best. I always made sure I iced, actually before and after, so joints that were a bit active. So there's lots of things you can do on your own.
Yeah.
And to get ready, but still seeing a professional is the way to go. And
another piece of or another thing that you can do with the use of technology is that, so I still have a very small clinical practice right now, and some of my patients know that specifically, things that they're doing that, increase pain or makes their joints uncomfortable, they videotape it. They take it on their phone, and then they show it to me when they come to see me. So, because sometimes it's difficult to describe, and you're not doing it, and your therapist or your doctor doing the assessment, they may not be able to reproduce what you experience.
Yeah.
But if you film it as you were doing the activity, as you're golfing, for example, your therapist may be able to analyze that and give you very specific advice. So that, again, the use of technology.
Actually, I could totally gap. That makes total sense. Because it could be some minor adjustment actually in stance or grip that could make a big difference.
Yes.
Yeah, very practical. See, she's not only brilliant, she's practical. We can't thank you enough, Linda, for joining us. If there are other questions that are coming in, we'll certainly deal with them via Facebook. We invite our audience members to share this to their timelines or to retweet the video. Dr. Linda Lee, we can't thank you enough for coming in. We really appreciate it.
Thanks so much, Cheryl.
Yeah. And good luck in all of your projects.
Thank you.
Yeah.